Hello, this is a virtual microscopy slide of a case of adenomyosis in the uterus. The definition of adenomyosis is when there are endometrial glands and stroma within the myometrium rather than in the endometrium where they usually occur. This is a benign, non-neoplastic process. So what we are looking at here is a piece of uterine wall, and this is the serosal surface. So we're actually quite far out towards the serosa. This is the outer half of the myometrium that we're looking at, or the uterine wall. And the myometrium is composed of smooth muscle cells. So we can see here there are these parallel bundles or fascicles of very bland, smooth muscle cells with slender, elongated nuclei. Sometimes when these bundles are cut on fast, we can see that the nuclei appear small and round, and this is when they are cut longitudinally. Going at low magnification, we can see that there are some abnormal areas here, here, and here. And let's go on to higher magnification. We can appreciate that in these abnormal areas there are glands, and here is a glandular structure with a lumen. And the glands are lined by very bland, single-layered columnar cells. These are endometrial cells, and immediately surrounding the glands, there is this stroma which appears a little bit different from the smooth muscle tissue of the myometrium. The stroma appears somewhat paler or bluer as opposed to the very pink myometrium, and the stromal cells look different with oval nuclei and quite pale cytoplasm. Within the stroma, there are some small blood vessels. This is endometrial type stroma. So we have endometrial glands and endometrial stroma located within the myometrium, and this is what adenomyosis is. And usually we will see the glands together with the peripheral cuff of stroma in all these foci of adenomyosis. Let's learn a bit more about adenomyosis. Adenomyosis is a non-neoplastic condition which is defined as the presence of endometrial glands and stroma within the myometrium. Usually this occurs in later reproductive years, so risk factors would include increasing age, but still within the premenopausal age group, multiparity, smoking, tamoxifen use, and also previous uterine surgery. Clinically, the uterus may be enlarged and palpable. There may be menstrual disturbances such as dysmenorrhea, menorrhagia, abnormal uterine bleeding, or chronic pelvic pain, and sometimes this can be associated also with subfertility. Here is a picture showing this enlarged globular uterus that we will usually find in adenomyosis and with an abnormally thickened myometrium. This is an interactive virtual pathology specimen that is taken from Pathweb, our free online pathology resource. Registration is completely free, and you can find the link in the video description. And you can actually rotate and magnify this specimen as you examine it in our virtual pathology museum. Grossly, adenomyosis would usually present as an enlarged and globular-shaped uterus. The area is usually quite ill-defined, so you can see here that there are these trabeculations within the myometrium. Sometimes the myometrium can appear somewhat yellowish as well, and we can see these little petechiae-like foci of punctate hemorrhage, and sometimes there can also be blood-filled cystic spaces. Occasionally, this whole process may be more localized or circumscribed, and this is known as an adenomyoma. There is a separate video describing the gross pathological features of adenomyosis that can be found in this channel as well as in Pathweb. On microscopy, we will see benign endometrial glands and endometrial stroma within the myometrium, and this really should be far away from the endomyometrial junction, so it should be at least one low power field deep to the endomyometrial junction. The endometrial glandular tissue may be inactive or it may be functional and show similar features to the cycling endometrium. There may also be atrophy, metaplasia, and even decidual change within the endometrial stroma. Rarely, the endometrial glands in these foci can undergo hyperplasia or even endometrial carcinoma, but this is an extremely rare occurrence. Here is just a picture to show you the normal endometrium and myometrium. And you can see that the myometrium is much pinker appearing than the endometrium because of the eosinophilic cytoplasm of the myometrial smooth muscle cells. And in this labeled picture, we can see here the endometrial glands and stroma. And this is the normal myometrium. And here is the endomyometrial junction. These pictures are taken from our normal histology atlas in Pathweb. So here is a labeled picture reflecting what we saw earlier in the virtual slide where we see the uterine serosa. This whole area is the myometrium, which appears very pink. And then we have these endometrial glands, some of which are cystically dilated, with surrounding endometrial type stroma. And this is going towards the true endometrial lining. On higher magnification, we can see these irregular glands and stroma, and the glands are lined by very bland-looking columnar endometrial cells. And you can see this cuff of stroma, which looks quite different from the surrounding myometrium. In summary, this is a virtual slide from a case of adenomyosis, where we can see the outer wall of the myometrium, this being the serosal surface, and this whole area being the myometrium, within which there are irregular endometrial glands with a cuff of surrounding endometrial stroma. The endometrial glands are lined by relatively uniform columnar endometrial cells, and the surrounding stroma is composed of quite uniform cells with oval nuclei and pale cytoplasm. And usually these foci of adenomyosis should be at least one low power field or 4 times objective field deep to the endomyometrial junction. This is a benign non-neoplastic process. Thank you.